All right, we will go ahead and get started. Thank you all so much for joining us today. My name is Emily Cantrell, and I'm the director at World Trade Center Seattle. And because we have people joining us from all around the country, a few quick notes about us. We are one of more than 300 World Trade Centers around the globe in about 90 different countries. We're owned by the Port of Seattle and managed by Seattle-based Columbia Hospitality. We are a member-based organization with the mission of bringing leaders together through both social and educational programs. And during this time of physical distancing, we are doing that virtually through our Navigating Business in Times of Crisis series. And if this is the first program of ours that you have joined, welcome. This is a 3-part series where we focused on adapting, recovering, and looking ahead. This is our last program in the adapting phase, and next week we will be moving on to the recovering phase. Couple of housekeeping notes. We are recording this webinar and we will be posting it online later today. The first 45 minutes or so will be spent on a moderated discussion, and then we will end with some Q&A. So be sure and think of some questions for our speakers. So as you know, today we are talking mental health. COVID-19 upended our world as we know it. We are a few months into this crisis, yet every day is filled with uncertainty. Most of us now live in anxiety-ridden times. Back on April 2nd, the Kaiser Family Foundation released results from a poll that showed nearly half of Americans reported the coronavirus crisis is harming their mental health. A federal emergency hotline for people in emergency distress registered a more than 1,000% increase in April compared with the same time last year. So this is why we are addressing mental health head on today. It's a topic that we cannot sweep under the rug or shy away from. And hopefully the stigma associated with discussing mental health will disappear, and we can discuss it just as easily and openly as we do our physical health. So thankfully for us, we have 2 mental health experts with us here today. Dr. Lindsay Henderson is a clinical psychologist and the director of psychological services at Amwell, wave Lindsay, which offers telehealth services. Dr. Henderson joins us from New York, where she serves as director of Amwell's therapy program and oversees hundreds of therapists across the country. Dr. Henderson is passionate about practicing in a telehealth setting, which is ever so important right now. And we also have Dr. Dorian Hunter, a clinical psychologist who teaches a variety of evidence-based interventions for problems related to communication skills and emotions. Currently, Dr. Hunter supervises graduate students at the University of Washington in psychotherapy and practices at the Seattle Clinic. She also speaks publicly and writes about mindfulness-based and cognitive behavioral therapies and strategies to regulate emotions and behaviors. Dr. Henderson, Dr. Hunter, thank you so much for joining us today. And this is going to be an intimate program, so from here on out, I'll refer to you as Lindsay and Dorian for the remainder of the program. So let's start off with a quick question. And Lindsay, you can go first. What is the most valuable thing that you have been doing to get through this crisis?
Sure, thank you. Thrilled to be here with you guys. Okay, so my quickest tip, and something that's worked for me and also some of the folks that I work with in therapy, is trying to focus on some gratitude and identifying something good that happened each day, something that you feel grateful for, and then trying to put a little bit of positive energy out into the universe when you're having one of those down days, because I think we're all having some extremes, ups and downs at times. And so I find, I've got little kids, I find that even like writing on our sidewalk positive messages or putting a sign on our mailbox that says thank you for delivering our mail, or ordering local takeout that makes me feel connected to my local community, those sort of positive little things really make a difference for me.
Love that. And how about you, Dorian?
I love that too. Thank you. I'm excited to be with you both. I've been thinking more about sort of turning inward, and like I think there's a lot of value in putting positivity onto the world, and I love that. And I think about filling my own gas tank too. So things like mindfulness and like starting each day with that, and stretching, and soothing myself with little things like I've got my essential oil diffuser and teas that I love, and like little rewards for myself to sort of balance the putting things out into the world.
A little bit of self-care, so
yeah.
important. So Lindsay, you are in New York. You're overseeing hundreds of therapists around the country. can you please describe to us really big picture the impact that this crisis is having on mental health?
Sure. So within the mental health field, we as psychologists have been able to look towards past research and literature to sort of inform what we can expect now. And overall, we know that this type of pandemic and resulting social distancing or quarantine recommendations really has significant mental health effects. It impacts folks more likely to develop symptoms of depression, anxiety, post-traumatic stress disorder, people who have pre-existing conditions or whose existing ongoing care is disrupted because of distancing recommendations, they are more at risk. But really, this is like a universal experience for humanity right now, for all of us in the US. All of us are subject to the impact of COVID-19 and the changes it's causing on our life. So none of us are immune to this. We know healthcare workers are at 3 times greater risk for developing mental health symptoms, including post-traumatic stress disorder. What we see at Amwell is, we provide online urgent care medical services as well as behavioral health and other services. And we're seeing that the demand for therapy and psychiatry services across the country has really skyrocketed over the past few weeks, and that that the mental health needs have sort of lagged by like 4 to 6 weeks beyond kind of the medical necessity that we saw at the beginning of March across the country. I think that kind of speaks to the fact that this is starting to catch up with people, and that first we were addressing some of our basic needs like adjusting to working and schooling from home, employment changes, et cetera. And now the mental health stuff is starting to build for people. And so this isn't going away. The quicker we address some of the mental health impact, the more likely it is to resolve. But there are both short and long-term potential kind of impacts on our mental health of this type of situation. And all of us are kind of are subject to this because it is, as across the globe, we are all affected by this.
Yeah, and we will get to some of those short and long-term implications during this program. Thank you, Lindsay. So now for some dire stats. More than 33 million people have now filed for unemployment over the last 7 weeks in the United States. And the unemployment rate is expected to be released tomorrow and will likely be the worst since modern record keeping began after World War II. The unemployment rate is forecast to reach 16%, which is the highest rate since the Great Depression, and economists estimate that 21 million jobs were lost last month. If so, it would mean that nearly all of the job growth in the 11 years since the Great Recession ended has vanished in one single month. Research has shown a strong link between economic devastation and suicide and substance abuse, which Lindsay had alluded to. A study of the Great Recession that was published in 2014 found that for every percentage point increase in the unemployment rate, there was a 1.6% increase in the suicide rate. So as Lindsay also mentioned, COVID-19 does not discriminate. We are all impacted, whether it's personally, professionally, and there is a lot of uncertainty. This is not going away tomorrow. So Dorian, what would you tell someone right now who's really struggling with the unknown?
Yeah, this is such a time of uncertainty for individuals and for all of us, sort of at a population level. We don't know whether we'll have steady employment, what the economic impact will be, what the health impact will be on us as individuals and all of us worldwide. Part of why I was excited to do this, be a part of this series, is that it's focused on adaptation, which I think is exactly the right thing to focus on right now. In psychology, we have this term called resilience. And so I think if we're all focused on building our own and each other's resilience, that will make a huge difference. I think it's important to balance too this idea that anxiety is harmful. A lot of anxiety comes from the idea that things are uncertain, and it certainly can be crippling for people. And if we use a few sort of cognitive coping strategies, it can help us get a bit of a boost. So like, for example, there is this mindset called a threat mindset. So this is when we perceive threat, something dangerous is in the environment that can harm us. We're much less resilient under those circumstances. If we have a challenge mindset and we think, okay, this is a challenging situation and I can cope with it, I can handle this, I can do this, we are much less prone to having difficulties. So there are things that we can do, and there are things like getting lots of social support, engaging in self-care like I talked about before. There are things sort of circumstantially in our circumstances that make us more sensitive, things like having lots of exposure to the stressor. So for example, with COVID, I think limiting access to news for many people is really important right now so that we're not inundated with it all day long. We actually have breaks from the threat cues. Things like having things be steady and predictable and some exposure to it, sort of as, I like the metaphor of building strength and resilience.
So we are getting so many reports all the time, and with technology nowadays, this information is right at our fingertips, and it can be really overwhelming, really confusing. So say we do try and minimize the intake of that. How do you begin digesting what you do hear, and what are some simple steps that you can do when you are overwhelmed by the emotions?
Yeah, take it piecemeal as much as you possibly can. So little bits of getting information rather than, I've heard, and I myself have done it, sort of rabbit holing in the news and getting lots and lots of information. So making it in smaller chunks, more digestible. Again, this threat versus challenge mindset, and having this, having thoughts like, I can actually get a boost from this anxiety and I can overcome these challenges. That being said, there are sort of, there's this unpredictability right now of what will happen. And so keeping things as steady as possible within the realms that we can control and focusing on what we have control over is really important too.
Okay, perfect. And even before this pandemic, the World Health Organization reported that depression and anxiety does have a significant impact on our economy. The estimated cost to the global economy is $1 trillion per year in lost productivity. Lindsay, is there anything that businesses can do right now to help their employees?
Sure, yeah. So I think that a theme you'll hear during this hour is just our hope that this can help propel mental health to be part of an everyday conversation within organizations or businesses or wherever folks are kind of working, spending their time being leaders. The more that we can normalize mental health is something that we have to work to maintain, just like our physical health. The more that we can, make it a part of our conversation, whether that's in employee communications or in, lunch and learn type things, just making it an open conversation for folks, I think could really be helpful. Any sort of addition of wellness tools or programming to take care of the whole person is great. And then of course, increasing access to good mental health care is important before this and increasingly important now. The great thing about mental health, Dory and I use our primary tools is our language, our voice. We don't have to lay hands on our patients. And so, technology and all that's available via telehealth right now can be easily, our tool, our craft can be easily translated to a telehealth environment. And so using those tech tools to continue to deliver care and wellness and make it a part of the conversation. And then also just being flexible with people, with your team, with your employees. Like, how do we adjust to help people work flexibly to, you know, accommodate for their kids home, to you know, be able to fit in some wellness, some self-care, some appointments in a normal work day. I think that that's really going to change after this. You know, we're going to kind of conceptualize our normal work day and our normal kind of office setting much differently, and I hope in a much more healthy way.
Right. Okay, thank you. So whether it's news that you're losing your job or you lost a loved one, people are receiving very difficult news, and oftentimes it is over the phone, a virtual meeting. So to either one of you, whoever wants to answer this, how do you suggest dealing with painful news in this matter?
Doreen, do you want?
Sure, yeah. I think there's something really important about, I think Lindsay and I are both practitioners of mindfulness, being aware of and present with our own emotional responses. This can be really difficult when we're getting overwhelmed and having overwhelming news like losing a job or death of someone. So I think there is balance to be had between allowing our emotions and taking breaks from things that feel overwhelming. In terms of allowing emotions, there are lots of things, sort of mindfulness-based practices you can do. Like there's a metaphor of Teflon mind that I like a lot, which is where we allow our thoughts to come and go, sort of like eggs off of Teflon. And there are things like just making note, imagining thoughts or leaves on a stream flowing through our minds. I think one of the most powerful mindfulness-based exercises we can do is just pay attention to sensations in our bodies. So balancing taking breaks with allowing experience, I think, is really critical.
And Dorian, just to back this up a little bit, for people who are unfamiliar with the term mindfulness in the sense of mental health, can you explain briefly what it is?
Yeah. So mindfulness in a nutshell is paying attention on purpose in a particular way without pushing experience away and without clinging to it. So it's very much like the Teflon mind idea or Teflon emotions.
Okay, thank you.
Mm-hmm.
So, you know, first we were saying that this was a period of social distancing, which I think we have all kind of leaned towards calling it physical distancing, you know, stay 6 feet away from each other, but you can still be social, you can still have virtual happy hours. But can you talk about why it is so much more difficult to connect right now? I mean, we can still see you, but what are the differences of connecting with someone virtually rather than physically?
Yeah, I'll be curious to hear from Lindsay on this topic as well, because she's got so much more experience, especially supervising people who are practicing our craft by telehealth. There are things that I personally have found really difficult in terms of connecting over telehealth with patients. We can't see, and with friends and family too, we can't see micro expressions the same way. We can't hear tone of voice quite as clearly. So we don't have access to those sort of subtle things that give us information about what people are thinking and feeling. And so it makes interpersonal interactions much more draining. And then there's the sort of problem with technology, the lag times and sort of hassles with it. So I think these are problems that can be overcome. And in the meantime, it's exhausting. So some things I recommended, like get off of Zoom at the end of the day, take breaks as much as possible, get on the phone to stay connected with people, and even turning off your camera so it feels less like you're performing all the time can help.
Lindsay, did you have anything to add on to that?
Yeah, no, all good points. And I think that we're getting to the point where we're all feeling this kind of Zoom fatigue, because there's starting to be articles written about that phenomenon. And I think part of it is that now that, you know, if we're lucky enough to have a job that translates to remote work, that means that we're sitting in front of a computer all day and often on video. And so then we're like now transitioning to video social time as well. And it's too much for us. You know, it takes a different type of energy. There are so many pros to what technology can bring to us, but it's not the same. It just simply isn't the same. And so I think it's exhausting in a different kind of way to try and replicate that social activity via technology, especially when you've done that all day for work. So it's a balance. I think we're so lucky to have the technology that we do right now, because our lives, I mean, we wouldn't be having this conversation. I don't know if any of the three of us would be employed like we are right now, let alone anyone on the call. So, you know, there's so many things to be thankful for, and that we still have to like work on setting those limits and just be paying attention. Like, what feels good? Does this work happy hour feel good to you? Or does it not? You know, and just sort of be, even if you're the life of the party usually, maybe 30 minutes on a work happy hour is enough. Like, that's just, it's all you can do. Pay attention to that and don't be afraid to kind of bow out.
That's great advice. Lindsay, earlier you mentioned short and long-term implications. So can we revisit that, and can you tell us a little bit about the trends that you are seeing?
Sure. So you brought up unemployment. I think it's worth noting that unemployment, there's a lot of differences in how unemployment impacts people across socioeconomic statuses. So those who are on the kind of lower end of all socioeconomic statuses are more impacted both by their mental health and their physical health by unemployment or you know, layoffs or change in employment status, and those who have more of those kind of those socioeconomic factors working in their favor are a little bit less impacted by that. So it's something to note, just that our physical health is impacted as well as our mental health. So what we know is that, you know, whether we're calling it quarantine or social distancing, a lot of us are functioning kind of with a much more isolated life right now. And that can really, that can fuel the anxiety, because we have given up so much control over our life and we don't know when things are changing. And I think one thing that I've been thinking a lot about is how are we going to help people navigate the anxiety and worry and like kind of guilt that comes up as we figure out how to re-enter our lives, because, you know, at some point our schools will open, or our daycares will open, or, you know, our restaurant, things will open, and how do you make the decision over what you're going to do? I think that that's going to be really hard for folks. People have had heightened anxiety and fear about the illness itself, but then of course all the ripple effects. This leads to things like insomnia, long-lasting depression and anxiety. People have suffered a great deal of loss and grief from this. So both like the loss of our existing lives and things that are important to us. Weddings are canceled, graduations are canceled, you know, these are all very meaningful events that define who we are, and we just lost them. And then also people are needing to process the loss of loved ones, like, you know, the death of loved ones, in a way that prohibits like the normal cultural rituals and processes around grief. So usually you are able to sit with someone if they are sick. You're able to say goodbye. And we know, we've all heard stories of healthcare workers holding up FaceTime family members to say goodbye to their loved ones because they're not allowed to visit. And that's actually one of the things that's most traumatic for our healthcare workers right now, is having to facilitate and witness that that really impersonal you know, end of life kind of communication. But then we also can't like commune and come together as a community to mourn, to celebrate someone's life, to have a funeral, to do all these rituals that are really important for our grief process. So that could really, not only is that hard now, but it could be problematic in the future for unresolved and complicated grief and kind of the long-term impacts of that. We're seeing things like an increased rate of domestic violence and likely child abuse, as well, as people are kind of holed up, and the existing protective factors aren't there for folks anymore, like children going to school or people laying eyes on kids outside of the family. And so those things, you know, can have some long-term effects as well. And, you know, just in general, like a real sort of sense of trauma. So You know, this is really disrupted life in a way that is making us question how we're going to continue functioning, and kind of how society is going to change. Like what's college education going to look like now? Like how are we going to, you know, vacation in the future, or like what is a workspace going to look like? What's the hospitality industry going to look like? All these questions that it's really like touches all parts of our life. And so it's been a traumatic experience for everyone. And those with more risk factors to start with are just more highly impacted by this, unfortunately. So I don't, you know, it's a hard question, Emily, because there's so many ways that this touches us, but hopefully that kind of helps. You know, there's the short-term stress reactions, and then the long-term impact of real significant life changes.
Okay, so before we get to how do we handle all of that, Lindsay, can you just talk a little bit more? You mentioned this briefly at the beginning of the program, but the risk that healthcare workers will be facing PTSD?
Sure. So we know that healthcare workers on the front line are I think around 3 times as likely to develop some of these more negative mental health symptoms, including post-traumatic stress disorder. So they are being, and it's not just doctors and nurses, it's everyone who makes a hospital function. And I want to make sure that we're recognizing, you know, the custodial staff and food services and everyone who's, you know, going in and doing direct patient contact and keeping those places going. So their PTSD comes not only from seeing folks die with them, from needing to be with people at their end of their life in a much more like frequent basis, and in a way that they're not equipped to manage, because our prior coping skills are not working as well right now. But they're also, they're terrified of bringing the illness home to family members, to children. They're, you know, separated from family members to try to protect them. So there are lots of factors that are impacting, you know, just how scary it is for them to work every day. We know that whether they've got the appropriate or sufficient equipment and PPE, that's a whole other discussion. But they, you know, the questions around what's unknown and what policies are changing or are in effect today versus tomorrow, these are all very hard for people to navigate, and the stress is just enormous. So we know that we have to take care of these healthcare workers because they're integral to our healthcare system, and they are really quite at risk.
Thank you. So we've talked a little bit about what we can do to take care of ourselves, but what can we do to take care of others? And I'm also really curious to hear your thoughts about children. And, you know, parents are in this difficult position as they're trying to work from home, teach from home. It has to be difficult no matter how much you love your family to be together 24/7. So what can we do to take care of others during this pandemic? Dorian, do you want to tackle that one?
Sure. I think taking breaks again as much as possible, getting out of the house if it's at all possible. I've got a friend who's in New York and has 3 children, and they literally haven't left the apartment. She's in New York City. And it's been remarkably stressful. Those of us who are able to add any sort of punctuation into the day, getting out of the house. I think there are things like interventions for people who are facing this trauma that Lindsay's talking about, healthcare workers, and on some level, all of us, things like there's an intervention called psychological first aid that is meant to targeted to prevent PTSD. And I think there are elements of that we can all be using. So a big part of it is increasing social support. And what they focus on, this is sort of like a long way around, what they focus on is bi-directional social support, so that we're not just focused on receiving social support, and we're not just focused on giving it. These things can get out of balance.
How can one provide psychological first aid virtually?
I think Lindsay would be better equipped to answer that. Many people are doing it right now.
Yeah. I mean, the cool thing is that anything that we can, most anything we can do in a room with someone, we can do virtually. And so, you know, there are foundations of psychological first aid, but you know, some like core concepts of how we process things, and particularly for children or family members, is you know, giving kids like a space to talk about things, to talk about what's on their mind, to ask questions. Being able to validate that the other person's feelings and experience is real and makes sense. So, gosh, it makes sense that you miss your friends right now. Like you haven't been to school in 2 months. Like I could see how you're angry or frustrated, you know, making sure that we know that the other person feels like that their experience makes sense, and that we can understand it. I think like, overall, we have to work on being gentle with ourselves and flexible. So we talk a lot about the importance of schedule and routine, etc. But I don't know, it's hard. Like it's hard. Some days are harder than others. And so, you know, being gentle with yourself around, maybe my kids ate brownies for lunch yesterday. That might be a true statement right there. And maybe we watched 2 movies yesterday, and like, maybe that's okay because you know, the day before was a better day. Like, how can we let some of the pressure and guilt go and model that for other people too?
And then let's flip this to the other side. People who are living alone. Can you talk about the difference between being alone, being lonely? You know, a lot of us have heard the statistic that being lonely or loneliness can be as dangerous as smoking 10 cigarettes a day. So can you talk about that difference and any advice you have for people who are living alone? Dorian, start with you.
So one thing that I think is really important is making sure that you're having actually meaningful social interaction, even if it's all over Zoom or phone or text, making sure that it's not all just superficial. And that can be tricky for a variety of reasons. Having, like I was saying before, the inability to see micro expressions and hear voice tone can make it really hard to know whether we're being rejected, whether we're actually having the impact we want to be having in interactions with people. So it feels almost like I would encourage people to be bold right now in terms of taking interpersonal risks and talking about things that are actually meaningful, and recognize that it will be harder. And sort of like Lindsay was saying, being gentle with yourself. I think there's something really important about sort of pushing yourself to grow and not doing it too much. Same as when we're processing things that are traumatic. Giving somebody space to talk about things that are difficult and not pushing them to do so. Same with ourselves.
Lindsay, do you have anything you wanted to add to that?
No, I mean, I think trying to figure out the ways that you can connect creatively is good. And we're getting to the point now where, you know, it might be really important to go for a walk with a friend if you live alone, you know, and that may not be something you felt comfortable doing 6 or 8 weeks ago, but now with health and isolation or distancing under your belt, like, and proper precautions, we can maybe start to take little steps to connect outside from a distance responsibly. But like weighing some of the risk benefits, I think, moving forward of connection. And I think that's going to be the trick for all of us. As I said earlier in this program, I think this is going to be hard for all of us to manage because, you know, your mental health is important, and connecting and not just using technology with people is important. So, so yeah, and hopefully, you know, as we move into May, that'll get even easier.
So here in Washington State, we are under the order to stay at home until May 31st. We did enter a new phase on May 5th where golfing is allowed, fishing. So that's good. But in the meantime, until we are able to go out for a walk with a friend, do either of you have any suggestions on how to stay interpersonally connected and remain close during these times? You know, we are suffering from Zoom fatigue. So is there anything else that people can try?
I myself have found a whole lot of benefit in having phone calls instead of Zoom meetings. And I think there is a loss in terms of not having face-to-face, like not being able to see someone's face when you're talking with them, but it also allows for doing other things, going for a walk while you're talking with someone or doing other acts of self-care. There also something that I think is a good way to facilitate this sort of intimacy building is there's all sorts of questions that you can ask one another. And there are various lists. So there is the 36 questions to help you fall in love with anyone, New York Times article. There are the Love Maps questions from John Gottman. So a variety of kinds of questions that basically ask really probing things and allow for more meaningful connection. That being said, it's not the same as seeing somebody's face and giving them a hug. Like it just doesn't have the same kind of impact, and we're going to do the best we can until we can be together again physically.
Lindsay, do you have any creative ideas?
So something that I've seen some people do is take advantage of some of the cool like online, like almost party games, like something that's structured instead of us staring at each other and trying to like have a conversation. I mean, well, my team, twice a week, we break for 30 minutes to play this game. You know, and so there, again, an amazing, you know, use of technology instead of, you know, just trying to talk to one another, engaging in something that is playful and an activity, even remotely, could feel different. It feels different for me anyways than just sort of talking.
I love that too. I've been doing that with my family and some friends as well. And it provides a nice balance between the like intimacy building questions. Adding some lightness is nice.
So as we are starting to wrap things up before Q&A, so everyone get your questions ready for us. What resources do people have access to right now if they're wanting to seek help for anxiety or depression? Lindsay?
Sure. So what's exciting for us in the telehealth area is that this current health crisis has really fast-tracked and broken down a lot of barriers that folks had to access telehealth. So reimbursement for mental health services via telehealth has gotten a lot easier. It's a covered benefit for far more people. Health plans are reducing copays to $0 for a lot of mental health services. So there's also, telehealth has never been more accessible to people. And I encourage you to call your health plan and see how you can take advantage of that. And in communicating that to your employee, to your organization, to your team members, that is an option. And then there are also like tons of, you know, there's lots of wellness apps right now that really help people kind of walk through this, these tips, these self-care guidelines, these kind of tricks on your own to practice mindfulness, to work on meditation. So again, more digital tools. And then also, you know, this might be because I'm a psychologist and I'm very engrossed in this space right now in this topic, but I think that there's a ton of general writing out there on this topic and more emerging. So, you know, I'm hearing from people I work with that, oh, it was really helpful to read this article in, you know, in popular sort of media, not academic media, but like, this is how we distinguish my anxiety symptoms from true COVID symptoms. That was really helpful for me to see that article. So it is being talked about, especially if you look for it like I do, which is an exciting thing to see. I think there's a lot out there on it.
Great. So we will open this up for questions. If anyone does have a question, please go ahead and type it into the chat box or the Q&A function. And while we are waiting to see if there are any questions, Lindsay and Dorian, thank you so much for all of your insight. What is one piece of advice or one takeaway that you want everyone to leave with today? Whoever wants to go first can jump in.
Do you want to go, Dorian?
Sure. I think if I were to say one thing that I want people to take away from this is that is to be hopeful, focus on capabilities, focus on what you can do, gratitude, and do things that are kind for others and for yourself. Like, I think having balance in terms of what you're contributing to other people and care that you're providing for yourself.
Great.
Yeah, and I apologize that I sort of said this, but it is my biggest takeaway is that, from a more kind of systemic and organizational standpoint, my hope is that this can just be a part of conversation in a way that is much more normal and comfortable for folks, that we can talk about our mental health, that we can talk about the anxiety, the trouble balancing work life, parenting, school right now. That can be like a regular topic of conversation, and that you can lead in that, you can do your part in leading in that, just talk about the wellness of our whole person right now.
Is there anything we have not touched on that you want to add? It doesn't look like we have any questions so far. Here is one. And then think about if there's anything else you want to say. But Max is asking, do you recommend completely separating work-home life, or is it better to embrace a certain amount of overlap? Great question.
That is a great question. My belief is that it's different for everyone, and that you got to kind of do a trial and error type thing. I've worked at home for years now, and one of the things that works for me is that it does allow me to be flexible with little kids right now, which I really want. So sometimes that means going back to email in the evenings, but I'll take that because I get a little bit more time with them at lunch or something like that. So, and then others really need to work on separating. So definitely, like, separation between work and home is always like an important, health topic for any of us. And now in particular, I think you got to do some trial and error and figure this out. I think partly it's organizational culture too, like, is there room and space for people to have a pet or a child on your lap during a call internally? I think that's part of it too. You got to navigate like what's kind of being modeled for you. So I don't know, trial and error for sure.
Dorian, do you have anything to add to that?
Sure. I think there are huge positives of being able to work from home. Things like having kids and pets easily accessible, and can be sort of an avenue for self-care. So I know for myself, I don't have children, but I have 2 dogs that are great to interact with and provide this like boost if I've got a short break. I get to say hi to my husband, and we get to have lunch together most days. And so I think there are huge positives, and having some sort of break, like going for a walk. I've got a friend who's going for a walk every day after work, because it's sort of like a replacement for her commute. And I have to say, I found myself like looking forward to my commute again. And so anything that we can do to weave in. That being said, there's a certain amount of acceptance that there will be things that will be harder about this.
So that leads us to the next question, which is from Mike. As we begin thinking about returning to work and starting our commutes again, are there specific recommendations for employers? Should we be planning different approaches in the office when we are able to return?
So I'm sure. That's a big topic. I think that has lots of layers to it. And I think that is something that we're going to be talking about for a long time. Again, the idea of flexibility is the first thing that comes to mind for me. So depending on your work environment, like if you could be flexible with people continuing to work from home some days, or decreasing the amount of bodies in an office setting, or shifting kind of work hours to be as flexible as possible. I think that I'm sure these are things that folks are already thinking and talking about. Doreen, I don't know if you have anything to add or.
Yeah, I think also to the point that Lindsay, you've made earlier, is that something hugely beneficial that employers can do is destigmatize mental and behavioral health problems. they're much more prevalent right now, and people are talking more freely about them. And I think that's a really positive thing overall. And the more destigmatizing we can be, the more we can reduce the shame that people feel, the more likely people are to get help that they need.
And speaking of that, Christine was asking first if you could please suggest specific websites. We will send those out in a follow-up email. And then, are there free services for those that do not have healthcare or have lost their jobs? Do either of you have any resources to recommend?
You know, I as far as like sort of national resources, I think we can kind of get back, maybe collect some for folks. I don't know of a ton, but that doesn't mean that they're not out there. I think NAMI, the National Alliance for the Mentally Ill, is always a good place to start as far as what they're able to offer for folks either with loved ones struggling or themselves struggling. But maybe Emily and Dorian, we can also try and see if there's other resources.
Yeah, so Christine will do some research and then report back to you in the follow-up email.
And there are some apps, if you look in the App Store just for psychological first aid, the VA has some really useful resources, the Veterans Administration, that are publicly available.
Okay, great. Evan is asking, what role on mental health does communication play for teams and companies? Essentially, are there ways that businesses can motivate, inspire, and support a good vibe and culture?
Definitely. So one thing specific to what's the COVID-19 pandemic that research has taught us is that people do best when there's clear and honest and direct communication, both from like leadership, you know, within the government and health organizations, but also within places of work and smaller communities. So as much as you can be transparent and honest with folks about you know, the continued status of their employment, things like their own benefits. You know, there's of course a balance of too much information versus what folks really need to know, but we know that a trustworthy source of consistent, honest information is something that really impacts people's mental health for the positive.
Dorian, anything to add?
I think this is a really big question. There are some specific things that leadership can do to motivate people. I think exactly as Lindsay was talking about, transparency is really critical. And also this a topic that Lindsay touched on earlier is that of validation. It's really critical to be understanding of what is difficult about this for people right now. And so connect with them around what's difficult and at the same time generate hope and help people feel like there are things they can do to increase their sense of control and mastery. And so I think that, you know, we could spend a long time talking about how employers can specifically do that, like doing things like having more time for interpersonal connection in meetings, and then talking about what goals people have and how to encourage each other, for example.
Yeah. Also quickly, sorry, just calling out and highlighting the good news that's going on. So I think that's one thing that actually social media has been very good at, is there's been so much positivity out there and stories and videos and whatnot of folks doing just amazingly loving things that, you know, I get choked up watching that kind of stuff. And there's always room for that within an organization, calling out the way that employees are contributing, you know, highlights, accomplishments, you know, what's going on that's good right now.
Perfect. I was going to say maybe we have a part 2 to this program for employers, and we can have a roundtable discussion about other things that they can do. So we can do last call for questions now, and while we see if any more come in, Dorian and Lindsay, any advice for people once they are able to go back to work, but they have now spent 2 months wearing, you know, like not business attire, and all of a sudden they need to put on a suit and hop in their car? Any advice for people needing to transition back into that work life and the new normal?
Do you want to go?
Yeah, I think being self-compassionate about how difficult the transition will be. It's been a difficult transition getting into working from home, and it will be difficult to transition back. I think one of the things that we will see a lot of is an increase in, for example, like social anxiety. I know clients and people I know who are socially anxious have had like a huge amount of relief right now. So there will be this like difficulty with having to engage face-to-face again. And the best piece of advice I have is be as self-compassionate as possible. There's someone asked for specific resources. There's a website, I believe it's called mindfulselfcompassion.org or .com. It's Kristen Neff's website, and it has mindful self-compassion exercises that are, I think, really lovely.
Okay. Great.
Yeah, and also just to add, like the flip side of that is that a lot of people find a lot of energy and like discipline and motivation from the routines that we've lost. So Doreen, you said you missed your commute. You know, it's okay to, like, there's a lot of mental health benefits to getting up and getting showered, getting dressed, and getting out of your house every day. And so, you know, recognizing that, okay, this is actually doing me good. And also, like, if you're relieved to be out of your house and away from your spouse, away from your kids, that's okay. Like, that's okay.
Yeah.
That's perfectly healthy and normal. Like, if you just can't wait to be by yourself or with your peers or colleagues and not with your family, that really makes a lot of sense. And so to let yourself be excited for those things, if that's where your head is at.
Perfect. So one of our panelists in a recent program said that with his team, he makes sure they all end every virtual meeting on a positive note. So with that being said, Lindsay and Dorian, tell us one thing that you are grateful for right now.
Sure. So there's always things to be grateful for. So beyond the big stuff of employment and health and all, it's sunny out today, which is not always the case in Western New York. And we put together some outdoor furniture this weekend. And so I'm going to be able to sit there at some point soon. So that's a little, for the first time in my life, I care about my yard because it's my only place to get out of my house right now. So I'm grateful for that.
Sounds good. And Dorian, you?
I love this question. I think it's so important to focus on the things that we're grateful for. Lindsay just queued a bunch of thoughts in my mind about things to be grateful for. And so all of those, the herb garden that I will be planting this weekend. And I think what I'm most excited about doing next is spending a little time with my dogs.
Perfect. And then before we go, we do have one more question from Christina. Any recommendations for working at home and telecommuting, and how to make telecommuting the new normal, and how to acknowledge that we will not go back to how we worked prior to the pandemic? So any closing thoughts around that?
From someone who's been doing it for years, I think recognizing both from an organizational leadership level and an individual level, the benefits of it so that people can get excited about it, you know, and recognize that there's pros with cons too. Beyond that, I think all this, you know, setting up an actual space for yourself, if you have that luxury to dedicate a space, or like I have a whole room, I'm very lucky. And getting up, getting dressed, showered, put on makeup, do your hair, whatever the thing is that you would do and go into the office, you need to do that same thing when you are getting ready for a day at work at home.
Perfect. Dorian, anything that you found now that you are working from home?
Yeah, some things like improving or increasing the degree to which I focus on little things that are soothing, having lotions or things that are pleasant around. And exactly what Lindsay was saying, that we need to do a lot of behavioral activation. It's, for many people, a huge risk factor for depression is being at home all the time, whether it's by choice or not. So doing all of the things that you would ordinarily do, getting up, getting showered, all of that sort of stuff.
Great. Well, Dorian, Lindsay, thank you so much for being with us today. Thank you to everyone who attended. This was recorded, so we will post it online later today and we'll send out a survey. We would really appreciate any of your feedback. It only takes a minute to complete. And our next program will be Tuesday, May 12th. That's just next week. So this will be good for anyone in Washington State. We'll be discussing the path to economic recovery here. We'll be joined by Brian McGowan, CEO at Greater Seattle Partners, and economist Chris Mefford from Community Attributes. So they will both be talking about the plan that they have been tasked with devising for our state. But on that note, thank you again, everyone. This was such an important discussion, and hopefully everyone found some good takeaways. And we'll hopefully see you again soon for part 2.
Thank you, Emily.
Thank you.
Thank you, Lindsay.
Bye. Thanks.